I'm sure some of you will be wondering why the Bank of Industry is supporting the healthcare sector. Well, the answer is not far-fetched. The healthcare sector plays an important role in the process of human capital development. As we all know, labor is one of the important factors of production, which also explains the saying, health is wealth. It is estimated that Nigeria loses more than $1 billion annually to medical tourism as many Nigerians travel abroad in search of high-quality medical treatment. In order to stem the drain in the nation's foreign exchange resources, the Bank of Industry has been intervening decisively in the healthcare sector by supporting ventures that will strengthen the country's healthcare delivery system, especially diagnostic and specialist facilities, producers of healthcare consumables, as well as manufacturers in the pharmaceutical industry. According to the World Health Organization (WHO), a well-functioning healthcare requires a robust financing mechanism. In Nigeria today, it is no more surprising to hear or see situations where cases that can be handled locally are being referred abroad. This leads to an outflow of much-needed foreign exchange.
If a person has a heart attack in Lagos, frankly, they do not have enough time to get to an international facility in most cases, because about 50% of people who have heart attacks die within the first hour. So you really want to be somewhere where immediate intervention can be carried out. So as much as medical tourism and capital flight is important, the single most important thing that we need to bear in mind is that the opportunities to save life are now available in this country, and we need to utilize them.
Imagine the number of people that goes outside the country for cancer care. For every person that goes outside for cancer care, there's also a relative that will go with him. So there's a lot of capital flight. There's a lot of foreign exchange that should have been spent within Nigeria that is being spent abroad. So having that state-of-the-art center that is also affordable to the people is something that will bring huge income for the nation in terms of foreign exchange.
In Nigeria, there was an estimate that was done by the Nigerian Medical Association, and they estimated that the outbound medical tourism in Nigeria is about $1 million annually. Some people have claimed that even that study was an old study, that possibly Nigerians are spending at least $2 billion annually going for medical tourism. And it's because there are some areas of care that people are not comfortable with in the country or inadequate. Cancer treatments, renal transplants, open heart surgery, some levels of orthopedic care. So when you put it together, we are spending our scarce resources. Secondly, sometimes the interventions are too late. By the time they get overseas to those medical institutions, it's too late. You spend so much money and people still die. So for us, it's an area that we needed to intervene, because we can save lives, we can save money, and the people are healthy, then the productivity will increase.